Matthew Holt, delighted to be. Quick interview today. We've got some big news from a company that launched at Health 2.0 just late September. This is Glen Tullman, no stranger to THCB and Health 2.0. These days, CEO of Livongo. Glen, so first off, remind people what Livongo does, and secondly, tell us about what happened today or yesterday.
Great. Well, Livongo Health is about empowering people with chronic diseases to live better. We're beginning with diabetes, and it's really about changing the entire experience of someone with chronic disease, how they experience that disease. So we're putting control using technology into their hands. That's what Livongo is about.
So let me expand that a little bit. I don't know if you've got one in front of you, but you have a little device, and I interviewed Stephanie Kowalski from your team just the other day, a little device which is kind of a combination cell phone. Oh, there it is. Look at that. Combination cell phone meter, coaching device, community. There's a lot of pieces wrapped up in that. So just explain a little bit what it does.
Sure. Basically, what we've done is we start with a smart cloud, which is a lot of intelligence up in the cloud, and we connect it to the industry's first two-way interactive glucometer. A glucometer is what you use to prick your finger, test your blood if you have diabetes. So you prick your finger, you test your blood, you get immediate feedback, but then it also goes up to the cloud. And in the cloud, we do a lot of personalization and analytics and inference. And then we send you back coaching on what you should be doing. In addition, we send that information to other people. So if your mother or father has type 2 diabetes and they're getting very low or very high readings, what we're doing is we'll actually contact you by text or by phone to say your parent is having trouble, and then you can actually intervene. Because for chronic diseases, they're unlike traditional healthcare where you go to a physician. These are 7 by 24 by 365. And the best thing we can do is share that information with your immediate care team. And who is that? It's mother, father, son or daughter, or other people who care about you. So that's really what we're focused on. And we can use that smart cloud. And then last but not least, if you get in trouble and you're really low or really high, you'll get a call within 60 seconds from one of our trained certified diabetes educators. And that is really reassuring because we create this perfect moment, which is just when you need help, somebody who knows about your specific situation is on the phone ready to help. So that's that combination of high tech, high touch that everybody's searching for.
Great. So you guys launched last September, so only a few months ago. You'd worked with a company, although some of the technology had been in a company called EOS Health before that I think you acquired as part of the launch. I don't quite know the details, so I can explain. But you launched and you had a 10 million round for your Series A, and you're already on to Series B as of today. So tell us about the next round.
Sure. Well, one of the places we launched was at Health 2.0, and I think you and I were on stage, so thank you. That was a great kickoff in September. And from there, we started to garner a lot of momentum. So signing large self-insured employers, working with large payers, and with large provider groups like Mission Health and Cornerstone Healthcare in North Carolina, great, innovative, leading organizations. And most recently signed a multi-year strategic agreement with Cerner, somebody you're familiar with, both from integration, because I know that's a hot topic with you, and distribution. So all of that momentum led to a lot of investor interest, and we decided to go back to the market because, to provide fuel for our expansion. And yesterday, or actually this morning, we announced a $20 million Series B funding round led by Kleiner Perkins and DFJ Ventures, and then some follow-on money from General Catalyst as well. So that $20 million is key because we're hiring aggressively to fuel our expansion.
So let's talk a bit about how you're going to get from here to there when these guys write these big checks, as you know, because in your other side of your life, you write a few of these checks yourself. As they say on the Shark Tank, I want to know how I get my money back. You're with the Cerner deal and the consultation providers. I know you have some employer clients as well. You're looking clearly to sort of integrate this into the mainstream of how people receive their healthcare. You're bringing sort of a enclosed package. It's more or less a sort of direct-to-consumer package, although that's not how you're marketing it, which includes some add-on coaching. How is this going to work? So now I'm one of these provider systems, and I now have the Livongo system. I have a lot of patients who have diabetes visiting my clinics. How am I actually going to put the whole thing together, and how's that going to happen?
So, number one, you're very perceptive because we have this view that rather than going through the traditional healthcare system, which isn't really well suited for chronic diseases, what we're doing is something that looks a lot like direct to consumer, or what we call B2B2C, because we do it with partners. So somebody like Mission Health or Cornerstone, they'll go to their patients, they'll give them a choice, and they'll say, if you'd like, we have this new innovative technology, and it makes your life easier, because chronic disease isn't about more engagement, it's about more empowerment. So what we do is they would receive, if you signed up, you'd get an email, and it said, would you like to sign up? You probably have no copay. You have unlimited testing strips. You never have to order strips again. Why? Because we know how many you're using. So what we can do is send them automatically. You never have to write down or record your information. You never have to plug into a computer. None of that. So your life just got easier, and you can share the information with whoever you want. You're totally in control of the information. We do all this for roughly what you or the payer is spending today, sometimes less, and now you're in charge. So you would receive a box at home, and it's a welcome kit. You open it up. It's a very Apple-esque type of experience, and you open it up. You take out that meter that I showed you, and then you just do what you've always done. You don't even have to turn it on. You push a strip right into this meter, and you push a strip right into the top, and it automatically turns on. And then it tells you, it shows you a picture of actually what to do. You put the strip in and you test. You don't have to connect to any network. It already sends it up to the cloud. And then if you need assistance, that assistance, you can press a button on the unit, or if you're really low and really high, you'll actually get a call automatically from someone who really knows about you and about your diabetes. So it keeps you, in a sense, out of the healthcare system. Why is that important? Because if you have risk, you no longer want patients showing up the emergency room. Patient doesn't want that. You don't want that. The employer doesn't want that. So what you want is for them to receive care when they need it, and only when they need it. And I guess I'll give you just one quick analogy, and that is, if you've ever been sick and you're not a doctor, and what you say is, gosh, I wish I could talk to a doctor right this moment. I have a question. And imagine if the phone rang right that moment and it was a doctor. What would you say? Perfect timing. And we create that perfect timing because we know exactly when you need help, because we're reading your blood. And today we're doing that by a prick of the finger, but eventually we'll talk to continuous glucose monitors and all kinds of other devices, because you'll be happy to know it's an open system. We have open APIs. We can talk to anybody at all. And we'll begin with integration with Cerner, full integration. So anytime somebody tests, if they authorize it, that information will show up on a Cerner system and as a part of Cerner's healthy intent in all their analytics that they're doing. And I think Cerner is a leader in the analytics space right now in electronic health records.
So let's shift slightly, because you brought this up, and there's been a lot of controversy and discussion in the last little bit about new ways of opening up EMRs with APIs and FHIR and the Argonaut project and all this. And I know you have opinions about this. So first off, how important? I'm going to ask you two questions. Don't spend too long on the first one. How important is this opening of APIs up to companies like yours who are having to plug into bigger provider systems like a Cerner and like others? And secondly, how real do you think it is, and particularly, obviously, the big kahuna everyone's talking about is how likely is Epic to really get open for its APIs? You've had opinions about them in the past, but let me know, where do you think they are now?
Sure. Well, first of all, what I'd say is having open systems is key to innovation. And that's really an important part of the future. You've got to allow that innovation to happen. So think about what Apple did when they opened up, even Apple, which is known as a closed system, but they enabled other people to develop apps through their app store. So they set the standards, and all of a sudden they had 10x their own investment. And that's what we tried to do when I was at Allscripts through the open platform. And Cerner has an open platform as well. So I've been strong on saying that open is very important, and that's going to be critical. I think that the customers out there ought to demand that. Now, having said that, the one thing I'd say is remember that today electronic health records are essentially data repositories. They're not yet information systems. And I think the furthest along, when you talk about healthy intent and what Cerner is doing, they're trying to take their electronic health record and move it to an information system. And what we've decided is by integrating our information real time into their analytics, we can now provide healthcare providers, not just doctors, but also nurses and care coordinators with real time information to better manage populations, especially those that the employer or the provider are at risk for. So that's the idea. So open, really important. The government ought to be pushing it. Customers ought to be pushing it. And I think that a number of the leading providers, whether it's Cerner or Allscripts or Athena, are all pushing forward. And I think it's pretty clear that Epic is fighting open, and they have their own idea of what open is. And open is Epic. And, I just have a different view of that.
All right. Well, we'll look forward to seeing how that plays out, because there's an article on the healthcare blog today about how they're opening up in their own way. And if we had Carl on here, he might say something slightly different than what you just said. But get back to the main news of the day. Been talking about Glen Tullman. Livongo Health just raised another $20 million to expand into the provider market. It has a large contract now with Cerner. And Glen, looking forward to seeing this as progresses. And I'm sure I will see you back in Chicago next week.
We will. We're looking forward to great HIMSS. Thanks. We'll see you.
Take care. That's Glen Tullman. Thanks. Bye now.